Welcome back. Ancient Egypt. And when it comes to our civilization, we are going to be surprised all the time with how much they were developed. They were modern. They really were in a race with time, and all the time they defeated time. Well, we are going to focus on a very exciting issue this time. It's medicine in ancient Egypt. And we are very much delighted to have with us live here in the studio Mr. Ihab Kamel, our researcher and historian, who is going to answer all our questions regarding this topic. Sir, a very good morning to you first.
Good morning.
Good morning, Mr. Ihab. Of course, medicine during ancient Egyptian time is a very interesting topic. Would you tell us when did the medicine start and in which era of the ancient Egyptian history did the medicine start?
Well, at the beginning we have to understand something very important, that the biggest achievements for the Egyptians, it's bringing medicine out of magical practicings into real medical practicings. The ancient Egyptians, they practiced medicine at a time when the whole world was practicing magic to treat diseases. So, and this had started at a very early age. In some papyri, medical papyri that dates back to the Middle Kingdom, like the papyrus of the Lahoun that was discovered by Sir Flinders Petrie. It dates back to 1850 BC, but we believe that it was copied from a more ancient papyrus, dating back maybe 600–700 years earlier. We believe that the ancient Egyptians had started practicing medicine as early as the first dynasty, about the 32nd century BC. And we're talking about practicing medicine, not magical medicine.
Yeah.
Especially that at an early age, like the third dynasty, for example, we had a man like Imhotep, who was discovered or described as a physician, or Hesira, which we found his wooden panels in his tombs describing him as a physician and a chief dentist at that time. So we can say since the beginning of the Egyptian civilization, and the Egyptians had started the proper practice of medicine.
Sir, I want to ask a question. Maybe it looks far from medicine, but in my humble opinion, it's a little bit related to other parts or other segments, if we may say, of the old Egyptian civilization. Maybe we can consider them genius when it comes to this because of the mummification. Because if they were not genius in anatomy, they would not be able to do this mummification process that way. And also in sculpturing, if they were not that genius in anatomy also, they were not going to be able to have these sculptures, their statues with this symmetrical way, and in this way, which is really amazing when we are talking about people who lived thousands of years ago. True? Or?
Of course, the ancient Egyptians, they did not leave anything just pass by like that. Most probably because the ancient Egyptians had satisfied their needs at a very early age by the discovery of agriculture. They satisfied the main basic need, which is food. And when the human being satisfied the basic need, he sits down, relaxes, and thinks. And once he thinks, he starts to discover things. He starts to observe things. Of course, the ancient Egyptians, they did all of that. And as a matter of fact, you had spoken about something very interesting, mummification. Mummification, this was their school of anatomy.
Yes.
That's how they discovered, or that was their entrance to the human body, to the discovery of the human body. And that is how, because they were very observative, they had discovered that everything was built in a proportion, with a certain proportion. Everything has a rule or has a law that controls it. And that's how they had started their research, they had started their own observation, and that's how you will find that they became very advanced in medicine. They related everything to the human body, so you will find that this reflects as well on sculpturing, because they were seeing that the human being is the perfect creature.
Right. What about the production of medicines, drugs themselves, and surgeries, of course, during that time?
I think many people would be surprised to know that the ancient Egyptian medical prescriptions, they comply by 37 to 40% with the modern British pharmacology protocol, which means that lots of their remedies, they are recognized now by the pharmacists, by the chemists or pharmacists. Apparently, we had found also ancient Egyptian documents, ancient papyri, medical papyri, which they are few in comparison to what we believe that was preserved in the ancient Egyptian tombs, but at least we found those few dating back to different historical periods describing diseases, their symptoms. And strangely, in some papyri, they describe some diseases as foreign diseases, Asiatic diseases. Diagnosis. And remedies or medicine or formulas which they had described in treating different types of diseases. Not only this, but also speaking about surgery. The surgical tools in ancient Egypt, you will notice that each tool had a name.
Yeah.
They had different types of knives and scalpels, and each one had a different name, which is an indication that they had an advanced surgery, especially in orthopedic surgeries, amputations, and even in some mummies, we had found prosthetic nails for treatment of bone fractures, because there were very common cases which the Egyptian doctors used to concentrate on. Mostly injuries, stings, eye diseases, which is a very important branch, ophthalmology, because these were the most common diseases. Different types of internal worms like bilharzia, like tapeworms, and they gave them names. You'd be surprised to know that in some papyri, which dates back to the Middle Kingdom, like that of Sir Flinders Petrie, they had prescriptions for treating animals' diseases, veterinary medicine. And this was very surprising, because we thought that the only animals that were treated were the sacred animals that were in the temples, that were presented as offerings. But we discovered that in this papyri, it's speaking about a common person who's taking his animal to be treated in the temple by the doctor, which is an indication that there was a veterinary medicine at that time as well. Surgery, of course, it was very important, especially when it came to severe cases like amputations or bone injuries. We even had found some mummies dating back to the late period, 26th, 27th dynasties, and they had surgeries in the skull, in the head, for treating skull fractures. I saw those X-ray photos. I remember there was a professor from Prague University, his name was Dr. Stuhal, and he was having a big lecture in Egypt about surgery, and he had shown us pictures of mummies that had successful surgeries in the head, in the skull, which are in the possession of the Museum of Prague up till the moment.
And women health also, sir. This was,
Yes.
I think, another branch which was very important. And till I think till the moment there were countries who are still choosing the chair of labor, or I don't know.
The labor stool, yes.
And maybe there are places, or there are some areas in Upper Egypt till the moment the same methods are implemented, as well as knowing also about the ancient Egyptians, that they knew how to limit or how to discover the sex of the baby while the mom is pregnant, and even to know if this woman is going to suffer something to prevent her from having babies. I mean, women health in specific, it lied on top of I'm not going to say the priorities of ancient Egyptian medicine, but at least it lies high.
Definitely it was, because in a country that in the best case scenario, its population was not more than 2 million, it was very important that you give a very good care to women and take care of them, and give a great deal of interest to the gynecology medicine. In all the papyri, medical papyri, you will find something very common, which is gynecology. Gynecology, that's a chapter, that's a standard chapter that exists in all papyri. But the amazing thing was the organization of the medical practitioners in gynecology. You had the doctors, and you had the trained assistants and the trained midwives. By the way, the midwife, it exists up till nowadays. In England, for example, you still have this job of the midwife, who is responsible only for helping the ladies to deliver their children. You will notice that they also had a great deal of care to the pregnant woman. And this care had started from the beginning. Because the ancient Egyptians, they discovered or differentiated between two things: suffering and the disease. The disease, merit, that's the word. Suffering, minute, that's the general health condition. So they had to make sure that the lady is not suffering from any disease, and they actually made a follow-up looking at the general health condition of the pregnant woman. When it comes to the labor stool, of course, the physician, he wants the easiest way and the less painful to deliver the baby, especially that the Egyptians were very slim. According to the descriptions of Herodotus, lots of children used to die during delivery because the Egyptians were very slim. So the hip bones, the distance between the hip bones were quite tight. Due to the Egyptian diet, the way they ate, the Egyptians were not overweight, they were not big. That is why they had to be very careful when it comes to the delivery of the baby. And the best way was to use the labor stool.
Akhenaten was an exception then?
Akhenaten was an exception, but he was not overweight, he was deformed. And there's a very big difference between both. But when you look at his bone structure, no, it's a fragile, thin bone structure. But there was a kind of a deformity to it at the hips area. Also, they had different types of doctors, which indicates how advanced the medicine was. The Egyptians, they were the first to put a moral code for medical practicing before Hippocrates. That is why they, at the very early beginnings of medicine, they used to choose the doctors or those who used to study medicine, they used to study it at the temple, and they were originally priests, because usually the priest, he's the holy man. He is a man of a very high moral level, which the people can trust to tell him what they are suffering from, and he was banned from telling his patient secrets to anyone, which is a very advanced way of practicing. The moral code they had put for medicine, the code of ethics, I think this is one of the greatest, if it wasn't the greatest contribution they had contributed to medicine.
Right. Well, since they had the idea of surgeries and they had the medical tools, definitely they were the first or among the first countries to have the idea of an operating room, the idea of a hospital. It handled, I mean, the surgeries, where did they take place?
Most probably in every temple there used, and there were some famous temples for that the people used to go there for healing or treatment. In Komombo, in Sayes in the north, or Salhagar, and actually the ancient Egyptians, many people think, what did they use for anesthetics? You don't need to look far. Look at the walls of the tombs. You will notice the poppy flower, opium.
Okay.
Oh, yeah.
Also, they had minor surgeries, like circumcision, because circumcision was, the Egyptians used to practice it after the person reached his puberty. So they used to create something like a painkiller from something they called Memphis stone. Memphis stone, that's a very pure kind of alabaster, which they mix it with vinegar, so they produce a kind of impure carbonic acid. Carbonic acid.
Analgesic.
Yes, this is a kind of a painkiller, a primitive painkiller, but it works.
Yeah.
To practice these minor surgeries like dental operations or things like circumcision of that sort. Of course, the people, when they used to go to the temple to be treated, or in the clinic of the temple, actually they were supposed to be treated for free, which indicates how noble this job was looked at in ancient Egypt. The rich people, they contribute. After they get healed, they contribute either with whatever they could offer from their harvest. And some of them used to cut their hair and weigh it with gold, and they take that weight in gold and present it to the temple. But this was a contribution. This was not obligatory. Only the rich people did that. But generally speaking, the public used to be treated for free.
Sir, also, as far as I know, that the Egyptians, the old Egyptians discovered, I'm not going to say modern diseases, but cancer, for example. They described cancer as if it's described right now, as an ugly tumor or as something incurable. This way of describing such a disease, how did they reach this point?
As I said, we have very few medical papyri, and I believe lots had been lost. But it is very true that they had described tumors, and they described the way the physician should react according to certain diseases. Some diseases which he should react as, okay, we will have to operate, or you will be okay and you will have a remedy. And some diseases you can only comfort the patient, which means which means that it's incurable.
A psychological way to deal with people with cancer.
Yes.
I cannot imagine that this happened thousands of years ago on this land.
It is describing the different types of tumor, and they said when you see someone with a tumor, just comfort him, which means that it's not going to be cured. Basically, you will notice that the ancient Egyptians, at a time when the people used to look at mental problems as evil spirits that are manifesting or obsessing the human people, the humans, the Egyptians looked at it as a disease. In the temple of Dendera, they have something called the sanitarium. The sanitarium, the patients with mental problems or psychological problems, they used to go there and sit in tubs where they received hot water treatment. By the way, this way of treatment for psychological or mental problems was very common in Europe up till the 19th century and early 20th century. We used to have two pipes, one bringing hot water to the patient, and the other is a hollow pipe which the priests used to whisper to the patient. We don't know the results, whether if it worked or not, but at least we understand that the ancient Egyptians, they got out of this circle of considering the mental problems are evil spirits, possession, or as a result of a bad magical spell or whatever, into looking at it as a disease. And I'm talking thousands of years ago. This is, I think it's amazing.
It is.
Right. So, sir, there was a god of healing, right, during the ancient Egyptian times. So was there a relationship between medicine, religion, and magic?
Of course, because you have to understand the ancient Egyptians were very religious, and not everyone is really well educated to know that it's a disease, or to accept the idea that it's only a disease. But we believe that in the very early beginnings, medicine had started with magic until they made their discoveries a bit by bit. But usually, because many of the doctors were originally priests, so they used to mix the medicine with magic. Also, as they treated the body, they had treated the spirit, the soul of the patient, because he had to feel comfortable. And yes, there were always a magical spell related to a certain remedy or a certain medical practicing, because there were certain deities that were related to treatments of certain diseases.
Well, I think that this is a very big issue. So we are going to leave you, sir, with a promise to see you again and to continue what we have started, because we still do have a lot of questions regarding medicine with ancient Egyptians. Mr. Ihab Kamel, our researcher and historian, thank you very much for being with us, sir.
Thank you very much for joining us, sir. And dear viewers, now we go to this short break, and we'll be right back to resume the rest of the segments of The Breakfast Show. Stay tuned.